According to the CDC, nearly 25 million adults in our country have high cholesterol. One Greensboro man knows all about the condition all too well. Andy Corin, the senior rabbi at Temple Emmanuel Greensboro, was diagnosed with high cholesterol. It runs in his family. His grandfather passed away at 68 from a heart attack. His father died from heart complications at that same age. Rabbi Corin is now in his late 50s.
Our emeritus rabbi, Rabbi Fred Gutman, he had a really great piece of advice, which is that, rabbis, clergy, we're not the only ones, but we are in high-stress jobs. And so it's really important once a year to check with a cardiologist. So in addition to your primary physician, to also enlist a specialist who can talk with you about heart health. And like so many things in life, you get advice, but this is one that I'm really glad that I acted on.
Rabbi Corin says medication has been instrumental in treating his high cholesterol, as well as healthy diet and exercising more. Dr. Kenneth Hilty, a cardiologist with Cone Health, helps treat patients with the condition. He says in general, people won't know if they have high cholesterol unless they get tested.
You probably should get testing. Maybe it's recommended as early as in your 20s, especially if you have a family history of heart disease or high cholesterol. And really, the key is the earlier that you can identify risk and treat it, the better your long-term outcome will be.
So we're going to continue the cholesterol conversation with Dr. Kenneth Hilty with Cone HealthCare. All right, so let's just start off. Let's talk about the dangers and the complications that could happen if high cholesterol is just left unmanaged.
Yeah, thanks, Tanya. Thanks for having me back again. What we worry about is the development of cardiovascular disease. Cholesterol takes about 10 years for a cholesterol process to develop that. So, and again, you may not have any symptoms with that. And that's why it's important to kind of identify high cholesterol early and treat it aggressively. If we're aggressive at preventing that, we can prevent the development of heart disease.
All right, so many people hear, oh, I have good cholesterol or I have bad cholesterol. Let's talk about what the difference is between the good and the bad.
Yeah, traditionally when we do a lipid profile, we're looking at what we call the good and bad cholesterol, as well as the total cholesterol, the bad being the LDL or low density lipoprotein cholesterol. And that's primarily been our target of therapy because most of the studies show if we can lower that LDL cholesterol to low levels, we can prevent events. There has been some study and research in the balance between HDL and LDL cholesterol, although more data is suggesting that we should focus on LDL. HDL is typically improve with things like exercise and healthy diet. And LDL cholesterol is also primarily driven by diet, but also genetics. In fact, a lot of patients have high cholesterol despite healthy diet and lifestyle, and that's driven a lot by your family history and genetics, as you've seen.
All right, so often people get, their blood work back and they're looking at numbers. What numbers should people be aiming for when they get their cholesterol screened?
Well, again, I tend to focus mostly on the LDL cholesterol, the bad cholesterol, but we also see patients with very high triglycerides. That's fairly common as well, the triglycerides being sugar-related compounds in the bloodstream. So I would look at both of those, really all the numbers.
Okay. And in addition to checking your cholesterol, what other tests or services should people talk with their provider about when it comes to this?
I think that's a good start. I mean, I think talking about your diet and what you can do with your lifestyle to improve that. But I think if you're having trouble with that, and that's when we start to recommend therapies, right? And so there are medications and therapies that are out there, generally well tolerated by a lot of people. In some cases, they're not. And then we have options for them. And that's why we, have a lipid clinic at Cone Health. In fact, we have a comprehensive prevention clinic as well. And this allows us to really address all these facets beyond just the cholesterol. To really look at overall cardiovascular health.
Let's talk about this because this is what we want to know. Food, how does what we eat impact our cholesterol?
So it's critically important. In fact, what primarily drives our cholesterol actually is fats, right? So saturated fats and the most common offenders are fried foods, butters, cheeses, oils, things of that sort. So trying to lower fats in our diet, most people think just cholesterol sources like meats. But in fact, that those fats drive the cholesterol numbers to be much higher. So low-fat diet, high in fiber, can actually help reduce cholesterol.
Okay, so let's also talk about exercise, lowering cholesterol levels. How much exercise is needed to make a difference?
It can make a significant difference, and primarily it comes from both weight loss, But independent of that, even if you exercise and you don't lose weight, your cholesterol can come down, particularly if we look at like triglycerides, for example. The triglycerides are energy sources in our body. So when we exercise every day and utilize that energy source, we can really maintain our triglyceride levels to be lower.
Okay, gotcha. So how do genes impact our cholesterol levels? We heard from the rabbi earlier about how it kind of like went in his family. What should people with a family history of high cholesterol do?
Absolutely. I think, that's been the biggest predictor for me over the years, is looking at families and family history, right? It gives us a roadmap and what potentially a patient could inherit. If your cholesterol is elevated in the family, or you have early onset heart disease and risk factors, I think just starting with getting a cholesterol test is a good starting point. And if your cholesterol numbers are high, then we can talk about how do we best lower that. It's a combination, usually diet, lifestyle, exercise. But it really starts with just recognizing that the risk is there.
Gotcha. And you said you would start with diet, exercise, that kind of thing. When might medications be necessary?
I think we reach for medication oftentimes when the cholesterol is very high, or in patients who, for example, do all those things that lead a healthy lifestyle, that already are eating a good healthy diet, or maybe made those lifestyle changes and find that their cholesterol doesn't improve. And there are, other certain tests that we can do to suggest that cholesterol might be genetic. For example, genetic testing, testing for something called lipoprotein(a), which is an inherited type of LDL cholesterol. These kind of things are unfortunately not improved with just diet and exercise alone, and you would probably need some type of medical therapy for that.
Mm-hmm. Okay, and who should someone contact if they're concerned about their cholesterol? Do they just talk to their primary physician about it?
I would certainly start with the primary physician. There are a lot of people that do what I do. It's a very specialized lipid management, but there are wonderful primary care physicians all over the area. And I think that, as an internal medicine doctor and a cardiologist in training, when I train, we learn to manage cholesterol. And I think that our primary care providers do a very good job of that. There are patients that are very challenging that I end up seeing, but I think in general that's a great place to start. And I think most patients can get very good care through their primary care providers. We're certainly happy to see the more difficult cases and kind of more exotic cases and things that we can certainly help with.
Okay, great. Well, we thank you for your time and your expertise and letting us know that we need to make sure that we get screened and that we need to pay attention to that diet and that exercise for sure. Thank you so much. If you missed any of this is going to be in the To Your Wellbeing section of our website, WFMYnews2.com.